I'm Bucky Boone. I'm chair of Appalachian Peace Education Center. We formed in Southwest Virginia and Upper East Tennessee 40 years ago because we were afraid of our government's obsession with nuclear weapons. And Beth Bingman is on the line, and she was one of those people, and we're still afraid. I want to welcome all of you here as I continue to admit people into our meeting. I want to especially thank members of our partner organization, the Irwin Citizens Awareness Network, for being here. Linda Modica, Barbara O'Neill, Francis Lambert. These people have been working for decades to raise awareness about the nuclear dangers along the Nolichucky River. 80 years ago today, the US government exploded a nuclear bomb over the people of Hiroshima, killing over 100,000 people, the lucky ones dying immediately. A normal, healthy person would have backed away and said, "What have I done? Let's get rid of these weapons." Instead, our government doubled down and in 2 days bombed Nagasaki, killing another 70,000. After the war, a thoughtful person might have begun the process of eliminating these weapons. But again, our government doubled down and started a decades-long arms race with the Soviet Union. 8 years ago, 100 countries around the world voted to pass the UN treaty to prohibit nuclear weapons. This was another perfect opportunity to join the world to reduce nuclear weapons. And again, our government doubled down and started a new buildup of nuclear weapons, even privatizing the process of making nuclear bombs. So now Nuclear Fuel Services in Irwin not only processes uranium for Navy's nuclear subs, but they are now licensed to process nuclear bombs. We want to hear today from Joe Mangano about research he's done about health effects in communities around nuclear processing facilities. Eleanor Goodrich is going to introduce him, and also she'll be coordinating the discussion after Joe's presentation. Thank you, Eleanor.
Thanks, Bucky. And yeah, as Bucky mentioned, we'll have an opportunity for questions and comments. You're currently muted, but we will give you the option to unmute at that time. You can also put comments and questions in the chat as they come up. I'd like to, before I introduce Joe Mangano, I want to also give some context for the area we're talking about in Nuclear Fuel Services. Nuclear Fuel Services is in Irwin, which is in Unicoi County, the first study that Joe conducted, and we're talking about a county downstream, Greene County. And Nuclear Fuel Services has a long history of serious safety problems, multiple documented cases of radioactive leaks, spills, violations. However, the Nuclear Regulatory Commission has allowed NFS to continue and even to increase their operations. Bucky mentioned they now are producing bomb-grade uranium, whereas before it was just the fuel grade. And this year they pursued a permit to intentionally dump wastewater directly into the Nolichucky, which flows downstream into Greene County. So that's a little context for why it's so important for us to hear from Joe Mangano. Joe Mangano is an epidemiologist and the executive director of the Radiation and Public Health Project. This is a really unique project because since the 1980s, they've specifically focused on conducting health studies near nuclear sites. The first time I was introduced to Joe Mangano was actually in Portsmouth, Ohio, when he was talking about a study that he'd conducted there. He's done these studies all over the country, and he's published 44 studies and articles, all in peer-reviewed journals. So we really feel like Joe's uniquely suited to help provide a national context and understanding to the health trends that we're seeing in our local region. Thank you so much, Joe.
Oh, thank you, Eleanor. Just one more thing about our group, Radiation and Public Health Project. We were formed in the late 1980s basically because there were no health studies being done about nuclear plants, whether they were weapons plants or power plants. The approach taken by the government really from 80 years ago throughout the atomic age was that every operator of a nuclear plant was mandated to test every year the emissions that were coming out of the plant and into the environment, and test the levels in the environment, in air, rain, water, and plants and so on. If these levels were below a certain what is called a permissible limit, they were considered safe, and the operator continued to keep their license and do their work. Low dose radiation is still radiation. It's like smoking several cigarettes a day. It's not as bad as smoking several packs a day, but there is still a health risk, and our group felt the need to fill this void. In terms of nuclear fuel services, what I'll be discussing today is the second article, second report on the health of local residents. I use the data provided by the Centers for Disease Control on mortality, which begins in 1968 and comes all the way to the present. The reason we're doing this is, before I get into the results, is that nuclear fuel services produces these very highly toxic chemicals: plutonium, uranium, americium, technetium, thorium. These are arguably the most dangerous chemicals on the planet. They're found in atomic bomb fallout. We feel it's important to actually look at the basic question: what are cancer rates and rates of other diseases near the plant? 2 years ago, the first report looked at Unicoi County, which is the location of NFS, Nuclear Fuel Services. The plant is located just several hundred yards away from the Nolichucky River. And the Nolichucky flows through Unicoi County and into Greene County. Now, a colleague of ours, Dr. Michael Ketterer, has done samples. He's a chemist at Northern Arizona University, and he has done samples and found levels of plutonium, not just in Unicoi County, right near the plant, but in Greene County as well. So this is the basis we have of looking beyond the county line of Unicoi County into Greene County. Greene is more populated than Unicoi. Unicoi has 18,000 people living there, and Greene has about 73,000. So this is a much broader study. All right. This report was rather basic, rather brief. In Unicoi County, we found over time that the ratio or the gap between the county and the United States rates of death grew over time steadily, and it grew especially fast for premature deaths, people who died who were 74 years and younger. Yeah, this graph that Eleanor just put up shows the results for Unicoi County. A key point here is that at the beginning, you'll see those lines are rather low. The death rates were pretty similar between the county and the United States in the late 60s, 70s, 80s, and even into the early 90s. And cancer rates were below. But that changed. Ever since the early 1990s, there has been a steady increase in the gap between the county and the national rate. So we took a look at what has happened in Greene County. You want to change the slide? Well, basically, we found the same thing for Greene County. There are two lines here. The blue line is the county versus U.S. ratio for deaths, all deaths from all ages. And the red line is for the premature deaths, people who died before age 75. And as you see, they remained low for several decades. And since the early 1990s, they have gotten higher and higher. The most recent rates are for all causes, all ages. The Greene County rate is 54% above the US. And for premature deaths, that red line, the dot, is 79% above the US. It's almost double. 100% higher would be double. So we're talking about close to double the rate. In another way to express what we found is, well, how many fewer people would have died in Greene County if that line had remained flat up until today? Well, the answer is something around 6,500, and most of them are people, again, who died before age 75. That's a lot in a county of just 73,000. You know, when I give presentations, I'm usually doing what I do now and using tables and graphs and statistics. But it's important to recognize that these aren't just numbers. These are real people. These are real humans. Every death, whether it's a cancer death or death from another cause, involves great suffering, not only to the person who dies, but to friends and family. What this tells us is that health in the local area near NFS must be made a part of the discussion about how NFS operates, not just now, but in the present. It has to be recognized. We cannot go on any longer assuming that low doses are safe. In fact, there are lots of studies in the medical literature, not just the ones we've done, which show that there, in fact, is there is no safe dose of radiation, even at the lowest doses. There is harm. I will stop there, and I'd like to hear any questions or comments from any of you. Thanks for the time.
Thank you so much, Joe. If you have any questions, you can literally raise your hand. You can use the little emoji icon down at the bottom and add the hand icon, or you can put your name or your question in the chat and we can ask that there. I also want to say that this is an opportunity for anyone with your more experience in terms of the history of nuclear fuel service. If there's any comments for anyone that's been very involved in this community recently that anyone would like to make, now would be a wonderful time as well.
Want to raise your hand? Yeah, raise your hand.
Francis Lambert, yeah.
Oh, yeah. A question. You mentioned earlier some of the radionuclides that are involved in the current water permit. I looked at the current water permit, and it has some 15 or more than 15 of those, from cesium to various plutonium and thorium and uranium nuclides. And my question certainly is, A, have they and do they continually allowed to go up in those water permits? And secondly, more importantly, even I want to know how and by whom is the testing of our safe drinking water done? Does TDEC do that testing? Do they get money from the federal government or from somebody? Or who does the testing? Is it self-testing or what else?
Okay.
I'll make a quick comment, and then someone who is more familiar with testing can follow. And my comment is that many of these chemicals, these isotopes, last a very long time. Each type of radioactive isotope decays over time. Some decay very fast, some take a long time. Most of the isotopes produced by NFS take a long time. And the example I'll give is plutonium-239. It has a half-life of 24,000 years. Now, that means we generally say that after 10 half-lives, it has disappeared. So an amount of plutonium-239 that's produced today and put into the environment will be around for the next 240,000 years. I'll stop there if someone wants to talk about the testing.
Was someone on an iPhone trying to speak up, or was that an accident? Okay.
They muted themselves. But we have, I believe we saw that we have a representative of TDEC on the call. And, or she had been. Jan Compton, would you like to comment on
the testing?
On the testing?
There is a question in the comments from Austin Counts. How did you consider local and U.S. population changes in the number of cancer cases detected?
The the rates that I used in the analysis are what have been adjusted for age. Rather than going through a complicated description of the statistics, basically what this does is allow an apples to apples comparison. If you took just what we call the crude rate, you divide the number of deaths by the number of people. Well, certain areas of Florida are going to have the highest death rates, of course, because they have the highest percentage of elderly people who tend to die in higher numbers. This age adjustment allows an apples to apples comparisons, and it is a very, very commonly accepted method in epidemiology. Did I answer the question, or?
Yeah, I think, if you don't mind, I think whenever I'm thinking about this question, I'm less considering the fact of like the age of the population and more considering the fact that within the time period that you're looking at, the population of the United States doubled approximately. And so how did you account not just for age, but for the fact that obviously if there are twice as many people, there's twice as many potential cancer deaths, no matter the environmental scenario.
Yes, while the report includes the numbers of deaths, for each period of time, the analysis is based on the rates, the number of deaths per 100,000 people. Okay, that balances things out. Even though you are correct, the U.S. population has perhaps almost doubled since the late 1960s. So has Greene and Unicoi County, but probably not as much. But again, we deal only with rates. Um, the number of deaths are used in assessing statistical significance. I mean, if these were based on 4 or 5 deaths, they would not be considered significant, but they are based on thousands of deaths, or even in each 5-year period, at least hundreds of deaths.
We also have a question about how this compares to what you've seen in other areas and other communities near nuclear facilities. If this is basically, yeah, what in that context, how would you compare these findings?
Yes, we've done reports and articles on probably, I'm going to say, close to 30 nuclear plants around the country. Many of them are nuclear power plants that make electricity. We've done others that are in part of the nuclear weapons operation. The plant that is probably closest in nature to NFS is Portsmouth, which is located in southern Ohio. And we were able to do 3 reports in the last few years about these same trends in cancer mortality and in all-cause mortality. And we found pretty much the same thing. I mean, Greene and Unicoi County look pretty much the same. We found the same thing, but the numbers were actually higher in Pike County, which is the location of Portsmouth. They have most recently had a premature death rate, age 0 to 74. I believe it's 107% above the U.S., just more than double, whereas Greene and Unicoi County are somewhat less than double.
We have a question from Appalachian Voices, Emma Kelly. Can you speak a little bit on how you accounted for socioeconomic shifts as well, access to early screenings for cancer detection, other widespread carcinogens, et cetera?
In the Unicoi County report, which is much lengthier and much more detailed, we included an analysis of certain socioeconomic factors. Certainly the percent of persons who are white and non-white, and the percentage who are young or old, or percent female, and so on. But even things like the percent of poverty and the percent who have no health insurance and things like that. Unicoi County and Greene County are higher than the U.S. They have a greater percentage of poor people. They have a greater percentage of people who are uninsured. That would be a factor. How much of a factor is a very difficult thing to do, but they should be considered. I want to make clear that in no way am I declaring that the entire reason for these increases should be attributed to NFS. No, lots of things can affect the risk of mortality, the risk of cancer, but the emissions from NFS and the continuing exposure to them, the cumulative exposure over time, should be mentioned in any discussion of this. And I certainly would like to see others, such as state and local health departments, participate in this kind of research to get a better idea.
We also have a question from Kimberly. Would you like to ask that yourself, or shall I read? Okay, so Kimberly says, when did NFS get permission to create bomb-grade uranium? I spoke with NFS as a reporter a few months ago about the outfall point, and they told me it has been an outfall for the past 50 to 60 years, and that they meet TDEC criteria for what is permissible at the outfall. Are you saying no amount is permissible? Thank you. And I know there's kind of 2 questions in there, so if I don't know if Barbara O'Neill or Linda wants to address some of the more specific to NFS, but Joe, if you can start with.
Well, I'll start with the very end, the permissible limits. Again, many studies, hundreds of studies have looked at low dose radiation exposures of different types, whether it's from X-rays or whether it's from working in a nuclear plant or living near a nuclear plant. These were put in a series of reports by a blue ribbon panel known as BEIR, B-E-I-R, the Commission on the Biological Effects of Ionizing Radiation. Their study in 1990 and the follow-up in 2006 concluded that, I'm going to use a fancy term, a linear no threshold dose response relationship exists. And that means no threshold. That's the key word. That means even at the lowest doses, there are risks to human health. Of course, as the dose gets higher, the risk gets higher, but there's no such thing as a safe dose. The first part I don't know the answer to, so someone else.
I can answer the specifics of that. In 2023, NFS successfully, we did fight this pretty hard, but NFS successfully secured their permit to refine more intensely the uranium that they had already been refining from fuel grade to bomb grade. And again, there's several people on the call with more background and decades of experience on this. So if anyone would like to speak to that.
Yes, this is Linda Modica. I would add that that Nuclear Fuel Services has been processing various quantities of uranium on and off for the bomb, for DOE and the National Nuclear Security Administration for years. It's a jobber, basically, for Y-12. It's been called, and this is thanks to research that Barbara O'Neill has done, it has been called by insiders a mini DOE. So this latest license amendment that it received is for the purification.
Speaking, and it was very informative about the specific type of nuclear stuff.
Sure. Yeah, the purification of already very highly enriched uranium. So because these are classified processes, even though Nuclear Fuel Services is a private corporation, the public is not privy to to what impurities, for example, are going to be removed. During the permitting process, the licensing application for the license amendment, Nuclear Fuel Services claim that the outfall would not, or the quantities would not be greatly increased. Barbara might remember if they added any new radionuclides to what they currently discharge. But I'd like to point out that, granted, in this case of purifying uranium for the bomb, that Nuclear Fuel Services in 2024 discharged americium, cesium, radioactive sodium, neptunium, radioactive lead, radium-224, 4 isotopes of thorium, and then uranium-232, 233, 34, 35, and 38. And so this is a complex of radioactive chemicals that NFS And this information is published in what's called the effluent monitoring reports that NFS is required to submit to the NRC, and that we, the public, have access to.
Thank you so much, Linda. I mean, as you can see, there's a lot of reasons for concern on this call, and thank you for your questions. We have another one from Ken Little. Has BWXT responded to the Greene County study? And I would add, have we had any response to this study by any the private or governmental industry? And will Trump administration policies regarding nuclear power impede government-sanctioned health studies such as the one improved by NRC, the National Academy of Sciences, and subsequently canceled in 2015?
Mm-hmm.
I can take the second part of the question. In all the years, now 80 years, that the nuclear plants, both weapons plants and power plants, have operated, there has been exactly one study of health done by the national government. And that was a study done in the late 1980s by the National Cancer Institute. It was done at the insistence of Senator Edward Kennedy. It looked at cancer mortality, much as what I've done here with NFS, near 62 nuclear plants, both before and after the plant began operating. The study is outdated. I mean, it only used data up to 1984. It didn't use incidence, the rate of detecting cancers, but none has ever been done. In 2009, the Nuclear Regulatory Commission proposed doing a study, and in the next 7 years, I believe it spent $10 million, something in that neighborhood, where they discussed the study and what the parameters should be. A lot of people were involved with it, and then in 2016, they just sort of canceled the study. They said it just wasn't feasible to do the study. So we're still left with none. We would hope that Health and Human Services would change their plan and support what I'll call an independent study, apart from government or industry, on this topic, very important topic.
Thank you. And in terms of responses to the study, obviously the Greene County study you've just released, have you, Joe, received any responses about either of the studies, even Unicoi?
Not so far, no.
We have two questions from Jackie Kittrell. Would you like to ask those questions, Jackie, or shall I read them? Okay, so I'm going to read.
I'm unmuted. That first one that I asked, I think has been answered about whether they were making bomb-grade uranium or handling it and processing it in some way. But the other one is maybe something we don't know yet if no one's on that knows about testing, but I just wonder what is being tested? Is it the river water, the groundwater, the soil, the animals, vegetation? And I'd also like, if there's local people on, to know if any of the physicians in the area have expressed concern or are dealing with diagnoses that, or they're looking into levels in people. Because some of those isotopes would be retained by the body. The plutonium and uranium and maybe others in that family would act like calcium, right, and go to bone and other different pieces of the body.
Joe, do you have any information about the testing policies?
Not about the NFS specifically. I know much more about the testing near nuclear power plants, electrical plants, but not about the weapons plants. Power plants, it's typically air samples, water samples, and different types of soil samples and maybe some vegetation.
Barbara O'Neill, I know that you're our like deep researcher, or
Mute. Okay. One of the things that Joe brought up that really is my pet peeve, I guess, with all this is the cumulative effect. Because we don't only have nuclear fuel dumping into the Nolichucky, we also have Aerojet, which was just recently purchased by BWXT, the parent company of NFS. And they're going to be bringing more processes in on depleted uranium. They have 3 outfalls into Little Limestone Creek in Jonesboro, which now, and also they're located 4 miles away from the oldest town in Tennessee, most historic district. And they're going to be transporting this stuff back and forth between Oak Ridge and Jonesboro, as far as we know. And on the roads and this, that, and the other, that's not been done exactly this way before. But you've got 3 outfalls going into Little Limestone Creek, which also goes into the Nolichucky River. So we're paying a great price here, in this area for nuclear, as far as I know. And as far as testing, I believe that NFS, also Aerojet, they're all self-reporting. They're self-reporting to the NRC on the biannual effluent monitoring report, and they're self-reporting to TDEC on, I think it's called the DMRs or whatever they call it. But again, how do we know? I don't think we have any independent testing going on except for what we have done with Dr. Ketterer. And this is not just one time. This is about 4 times over a period of years with the same result. And again, there is no level of radioactivity that is safe, okay? And especially in the fact that the Greene County people take their drinking water from the Nolichucky. Fortunately, Irwin does not. Irwin has some wells and springs, but they're located all around that area. So it's important, I just think very important. And there's cumulative also effects into the sediment in these rivers and streams. So what may be okay one day after a big rain and it stirs up everything may not be okay the next day. And so that's something that I addressed to the NRC one time, and they said, well, we don't regulate sediment. So anyway, that's my take right now.
Yeah, thank you. Kathy Helms, did you want to ask your question, or I can read it? Kathy writes, Idaho National Laboratory has proposed changes to the regulations on ALARA at as low as reasonably achievable. If this goes through, do you have any concerns about public exposure? Joe, do you have any responses to that?
Yes.
Yeah. Succinct. Okay. Michael Lee. Oh, Michelle Lee, Michael Lee. Did you want? Are you interested in asking, or shall I? Yeah, there you go. Oh, darn it. I'm sorry. I tried to unmute you and I think we hit it at the same time. Can you unmute yourself again?
Okay, got it. So yeah, now I was just asking Joe to comment on the fact that the NRC regulations, I'll just read what I wrote in the chat, are based on 1970s era science, completely disregards vulnerability of developing fetus, babies, girls, children, women, disregards non-cancer negative health outcomes, and basically, it's ridiculously outmoded. And I just threw in also a site of a National Academy study that was done a couple of years ago that basically confirms what we knew about this.
Yeah, what Michelle just said has been very clearly documented by research. That being a certain dose of radiation affects all human beings, but it is especially harmful to children, even more harmful to infants, and even much more harmful to the developing fetus, because they are small, their immune systems are immature, and their cells are dividing very rapidly. They're growing so fast. So when you impair a cell, when a radioactive particle hits it, the chances that it's going to duplicate into more impaired cells are greater in a fetus, an infant, and child than it is in an adult. No regulation I know of has ever accounted for that.
Thank you. Do we have any more questions? Again, you can post it in the chat or you can wave your hand and I'll. Bucky Boone.
I would like to try to repeat a concern. Another partnership that APEC has is with the Small Modular Nuclear Reactor Watch Group out of far Southwest Virginia. And one of their members expressed a strong concern that this type of study doesn't compare apples to apples, in that Unicoi County and Greene County have a high poverty rate, so that of course they're going to have a higher rate of cancer and a rate of cancer deaths. Can you respond to that, Joe?
Yes, the response is they did not, Unicoi and Greene County did not have a higher mortality rate and cancer rate in the late 60s, 1970s, 1980s, and into the early 90s. It was nothing, it was quite comparable to the country as a whole, even though in those times there were higher rates of poverty. There were lower education levels and less access to care and things like that. It's only in the last 35 years or so, since the early 1990s, that we've seen that gap grow. The question is not so much why are local rates high now, but why are they high now and they weren't so high years ago? What changed? I mean, again, I'm sure there's no one single factor that accounts for everything, but you must put the cumulative exposure to NFS radioactivity in the mix, in the discussion.
Thank you. We have a question from Beth Bingman. Did you want to ask that yourself? Okay, I'll read.
Yeah.
There you go. Great.
All right. I'm just wondering if there's any specific information about childhood cancer rates in, well, Greene or Unicoi County.
There are. I'm trying to remember if I put something. There was nothing in the Greene County report, but in the Unicoi County report, oh dear. Yes. In the late 60s and early 1970s, Unicoi's death rate from all causes in children under 15 years old was 5% above the US. In the last 2 decades, it's 39% above. There weren't enough childhood cancers to make that significant. But for all causes, there's been a big increase as well.
Okay, thank you.
We have a question from Christopher Black. Did you want to ask yourself?
Yes, good afternoon. I have a question surrounding research that has been done by regional universities as it relates to this matter. understanding the research capacities of our regional universities such as UT, ETSU, and the various cooperative agreements that they have with institutions like the Department of Energy, the EPA, the Appalachian Regional Commission. Is there any supporting study that's been conducted by these universities? The reason that I ask this is because, having been in public policy and politics for quite a while in the region, I have seen time and again where scholarship being done externally is not held as high, and therefore our leaders don't feel as though there is an impetus to act. Does that make any sense?
Mm-hmm. I'm not aware, as I said earlier, I'm not aware of any longitudinal studies over time of rates of cancer or rates of death near nuclear fuel services done by any university or any government group or any nonprofit group.
To follow up on that, is there opportunities for partnership? I think Christopher's comment in terms of raising awareness to this study, are there ways that we can partner with other educations and educational institutions that you would recommend in order to sort of raise local awareness?
Well, yes. The recommendation would be that at any university, faculty member who has an expertise in medicine or epidemiology, we very much welcome an exchange of ideas or even a partnership in conducting research of this type.
Kathy Helms has a follow-up. I think she would like if you could elaborate more on your concerns, the reasons for your existence of concerns about proposed ALARA changes.
Several weeks ago, the Nuclear Regulatory Commission issued I'm not sure what it was, but a notice that they were reconsidering the term I used earlier, the linear no threshold dose response, where no threshold is safe, no level is safe. What that means, I'm not sure, but they took public comments in person and on Zoom, and they also took written comments. I know a number of people that have written that have participated. I sent in for the group our comments, pretty much based on those blue ribbon panel reports and other articles in the literature. Again, the first report had 900 references to it, and the subsequent ones had hundreds, supporting the no threshold belief. I'm not sure what the NRC is planning to do. Are they planning to support that there is a threshold below which there's no health risk? I don't see how. I really don't see any science that would support that. But I guess we'll just have to wait and find out, because they closed the comments just several weeks ago.
Frances Lambert.
Yeah, just a quick question, please, to going back to testing. As was said earlier, that NFS is doing all their results by self-report. My question is this happening in other states too? Do other states rely only on self-report for these kinds of pollutants? That's my question. Is Tennessee unique in this?
No, I believe that all nuclear weapons plants and nuclear power plants self-report their emissions and self-report their testing of environmental levels.
Okay. Thanks. Thank you.
Do we have any more questions?
Barbara,
You're muted, Barbara. You're still muted.
while Barbara gets that, just an anecdote. One time the regional commissioner for Region 2 of the NRC, when we brought up to him the fact that NFS self-reports, he said, trust, we trust, but verify. And I believe that they trust. We're not sure that they ever verify. Anyway, Barbara maybe Eleanor, can you help her get unmuted? Is there a way?
Just to ask, unmute, unfortunately.
There we go.
Yes,
Okay.
thank you, Barbara.
Okay, finally. Okay. One of the questions that had come up was, were there any doctors and I can only speak for Irwin because that's where I'm from originally, but I don't know about Greene County. But yes, in the early days, there were doctors that really spoke out against what was happening at nuclear fuel as far as the air and the water, but they were run out of town. And so that's typical. I have had one doctor in Irwin tell me that the rate of thyroid cancer in Irwin was really high. That was all he would say. And that's typical for being around a nuclear facility. Okay, that's it.
Eleanor, do you mind if I throw in one thing?
Of course,
about
this is
testing?
your show.
About testing, thanks. Although our group is not really involved in testing for environmental levels, we have done the only study testing in-body radiation of Americans living near nuclear plants. And that is we call it the Tooth Fairy Project, which sounds like a fun little project for children, but it is a serious scientific study measuring levels of strontium-90, which is one of the many byproducts of nuclear fission in weapons and power plants in baby teeth. This was not a study that was original. It first was done in the late 1950s and early 1960s during the period of above ground bomb testing, when citizens and scientists in St. Louis got together and found an enormous increase in strontium-90 as bomb tests continued, and which led to the passage of the Test Ban Treaty, banning the above ground test. We found in these 5,000 teeth, we found near 6 nuclear plants that there was an increase over time in every one, that levels were higher than in teeth of children living far from nuclear plants. And the third thing we found was there was a link between trends in strontium-90 in teeth and trends in childhood cancer. There are 3 plants. When one went up, the other went up, and one went down, the other went down. To this day, that remains the only study of in-body radiation of Americans living near nuclear plants, which is not in any regulation. So yes, we have tested.
We have a comment from Cell that's sort of reiterating the same concerns expressed earlier about self-regulation and self-reporting and how that relates to the long-term impact of cumulative ingestion and radioactive compounds. There's a question from Kathy Helms. NFS previously has attributed a rise in cancer rates to fallout from Nevada nuclear tests. Have you seen markers to differentiate this?
above ground nuclear weapons tests certainly posed a risk of cancer and other diseases. This was acknowledged when the test ban treaty was signed by government officials. Most notably President John F. Kennedy, who in a speech said, we have to be concerned about children with cancer in their bones, with leukemia in their blood, and with poison in their lungs. Yes, there was an increase in cancer from nuclear weapons tests, which is something we're actually working on now using baby teeth left over from the original 1960 study. However, when a study like the one presented today, where it looks at a particular county or an adjoining county to a nuclear plant, can't be attributed to nuclear weapons testing, because basically years ago, the amount of fallout, say in Tennessee, didn't really vary very much from county to county, right? When it rained in Tennessee, it rained and got into the food chain and thus into people's bodies. It's when you see these differences county to county that points much more towards something specific to that county, including NFS.
And then we have a question from Barbara Newsom. Did you want to ask that?
Oh, thank you so much. Yes, I have 55 years and just retired from nuclear safety and security, including all of these sites, most of them that you mentioned. How could we make an improvement in the oversight process? In other words, at a nuclear power plant, if they're self-reporting and they have resident NRC inspectors. I'm really interested in what Joe has to say about the current climate for improving oversight. Mm-hmm. You're doing a wonderful job today, by the way, as public participation is the most important thing in my view.
Barbara, my simple answer to that is the studies must be done, even if they haven't been done before, and they must be done by independent sources independent of government, independent of industry. That is really the key here. An example is, years ago, lead was a very big problem in our society, and it wasn't until certain, mostly university-based people, or not involved with government or industry, like Herb Needleman, did studies and showed that the higher the lead in children's bodies, the greater the chance of neurological diseases. That has to be done, I think, if we're going to get a better handle on the effects of radioactivity exposure.
Thank you.
And we're coming up on an hour. It looks like we don't have any more questions. Bucky, would you like to take us out?
Well, I just want to thank Joe for doing your work for how many years you've been doing this. Thank you very much. And thank you for studying our part of the country. And I want to thank all of you all for coming. And I hope we see a report about this study in the Kingsport Times tomorrow, and maybe some other newspapers.
And thank you. It will also be available on Appalachian Peace Education Center's YouTube channel. We'll have a link that we've recorded this entire conversation, and you can please share it with our neighbors. Yeah.
And one more time, I'd like to thank the members of the ECAN for the decades of work that they have done to raise this issue. Thank you all for being here.
Well, thank you. Thank you. And Barbara Newsom and Mari and all our friends here who have joined us. We appreciate your participation and your questions and concern, sharing our concerns. And we appreciate so much Joe Mangano for his contribution to the science that needs to be done. And appreciate you, all of you. Thank you so much.